Welcome to In a Heartbeat, coming to you from the studio of WMTV Channel 5 in Grosse Pointe Farms at the Grosse Pointe War Memorial. We are broadcast also throughout southeastern Michigan on AT&T UVerse on Channel 99. I'm Dr. David Bali, and I'm your host for In a Heartbeat. The events that go on in an emergency room can be exciting, frightening, and dramatic, and are the types of things that are made for movie scripts and television shows. But they also provide an important source of comfort and relief to patients and families who need their vital services. My special guest today will help to prepare us for a possible trip to the ER in terms of what we should know, and also inform us when and how to use it. He is, obviously, he's board certified in emergency medicine, and he is the managing director of Midwest Emergency Services. I also want to mention that he was a fellow classmate of mine at Wayne State University, and a great one at that. And his name is Dr. James Fox. Dr. Fox, welcome to In a Heartbeat.
Thanks, David. It's nice to be here.
It's a pleasure having you. Dr. Fox, I thought I might just start out by asking you, what made you decide to go into emergency medicine?
Well, as classmates, I think we both struggled with the career paths we would choose once we were in medical school. For me, I always enjoyed the procedural aspects of medicine, and once I had an opportunity to rotate through the emergency department at Detroit Receiving Hospital, I was hooked and really enjoyed my time there and felt that that would be a great career for me to pursue.
That was a wild place, wasn't it?
It was and still is a fairly unique place to practice.
And for our viewers, you're a man who wears many hats. And why don't you share with them some of the things that you do? Perhaps you know what emergency rooms you're associated with, and you're also, I believe, teach or have taught at Wayne State University and other things.
Well, I do wear a lot of hats. I truly enjoy what I do, and for me, when you enjoy things, it's not really work, it's just an expression of what you enjoy to do. So I've been blessed to be with the St. John Health System since 1989. About a year and a half after I finished my residency program down at Receiving Hospital, I came to St. John and spent 18 years as the vice chief of emergency medicine there. As my family lives in the community, I took great pride in trying to be more involved in the community and had the opportunity to get involved with the St. John Hospital Guild. The Guild is an organization of community business people, as well as hospital administrative people and community leaders who, since 1948, have been raising money to support the work at St. John Hospital, and through that work, improving the health care for the citizens that live in the greater Grosse Pointe area.
Maybe you could share with us, Dr. Fox, some of the things that through the Guild have been brought to the community as a result of the fundraising that's done.
Well, initially, in 1948, when the Guild was formed, the hospital was a dream, and the community leaders at that time got together to just raise money to build the hospital. In 1952 is when St. John Hospital actually opened. Since that time, capital campaigns have been brought to bear on the capital expenditures at the hospital, such as new CAT scans, new surgical equipment, PET scanners, the latest and greatest technology that we can use as clinicians to the betterment of our patients. Most recently, we raised over $1 million to build out a new emergency department, and the Guild, with the significant help of the John and Marlene Bowl family, were able to fund a brand new emergency center, which has been open now for 2 years.
That's really great, and we all benefit from that. And I'd like to get more into that a little bit later. And perhaps relating to your specialty, a patient never really plans on going to the emergency room or wants to, but it's great that it's there when we need it. How would you best prepare a patient for the possibility of making a trip to the ER?
Well, we see this every day in the emergency department. As you said, no one wants to go to the emergency department, but we are there 24/7 if you need us. My advice to the viewing audience would be prepare yourself. Get together some information that would be extremely important for an emergency physician who doesn't know you as a patient to learn so that they can best take care of you should an emergency happen to you, whether it's traumatic or medical in nature. So my advice would be get a list of your medications, not only the names of the medications, but the dosages of those medications. Also know your allergies, know your past medical and surgical history. These are things that the emergency physician would find very important should they need to take care of you in a time-sensitive situation.
And a person who goes to the ER can't assume that they'll be able to share this information, or they'll be in a state of mind to do that, or that they'll have a family member or somebody who knows them who will go along and give them that information.
That's exactly right. When you're in an emergency situation, things become very chaotic for you. You're concerned about your health. You're usually frightened, or at least very worried about what's going on. And the last thing you're thinking about is gathering up information to share with whatever emergency physician you might see once you arrive. So my suggestion is to get this written down, stick it in your wallet or your purse, so that when you do come to the emergency center, that information is readily available. You don't have to think about it. You can just direct somebody to where the information is, and then they can take it from there.
It possibly could even impede or slow down your health care in some capacity if they didn't know what medication you took, what your past medical history was, or if you were allergic to anything.
Well, it certainly makes us less comfortable, depending on the situation, moving forward with certain therapies if we are unsure exactly what sort of medications you're on or what some sort of allergies you might have.
And also, I think you had mentioned before, it's important to know who your primary care physician is, because you may want to contact them and find out some relevant information.
Great point. It's extremely important. I reach out to primary care providers all the time when their patients are in the emergency department. The reason being is exactly as you mentioned. No one knows that individual better than their primary care physician. Can give me tremendous insight into past problems, tests that have recently been done that I don't need to repeat, which helps save the healthcare system tremendous amounts of money. So that's another thing that I would, again, write down, stick in your purse or your wallet so that's readily available. Sometimes in the heat of the moment, we forget who our doctor is, or we certainly forget how to contact that person. And if it's written down, you don't have to worry about it.
That's great information. Dr. Fox, maybe we could also, in those terms, move on to what are the reasons a person should go to the emergency room?
Great question. I think that there's been a lot of confusion through the media as to when people should actually access the emergency department. The first point I would make is that if a patient is ever concerned as to whether or not they should access the emergency department, don't be afraid to just call your primary care physician. Usually, most primary care physicians have a way to access them 24 hours a day, whether it's calling their office or calling their answering service or whatever. Primary care physicians are a great resource that patients should use in directing their care toward the emergency department. However, there are occasions when you can't reach your primary care physician, and there are some good rules of thumb to kind of keep in mind. For most of my listeners, or for most of your listeners, I would say a good rule of thumb is that chest pain of any type, if you're over the age of 40, certainly is something to be concerned about, something worth being evaluated in the emergency department. Any sort of nausea, vomiting, diarrhea that is intractable, meaning that it lasts, vomiting, diarrhea that lasts for a long time, should be evaluated in the emergency department. Any sort of stroke symptoms, we're very, very aggressive in the treatment of stroke these days, much more so than we were 10 years ago, because we have new modalities of therapy that we can bring to bear on the patient if we see them in time. So slurred speech, numbness in an arm or leg, um, intractable headache are all things that would warrant a visit to the emergency department. Um, Shortness of breath, that is new for you or doesn't go away in a short period of time, another good reason to come to the emergency department.
And as I know you're aware, and more of the public is becoming aware, symptoms of a heart attack may be different in men and women. And so sometimes the symptoms in women may be a little bit atypical.
Correct. And that's a great diagnostic challenge for all of us in the emergency department. Women's symptoms do present differently than men do. And so the typical symptoms of substernal chest pain or numbness and tingling in the left arm or up into the jaw, which we typically see in men, not always, but typically, may not be how women present. And so not only is it a diagnostic dilemma for emergency physicians, but also it's difficult for those patients to say, oh, I should go to the emergency department because these are symptoms of a heart attack. With women, it's a little bit more challenging.
Are there any atypical symptoms in women that you could mention?
Well, certainly just sometimes just fatigue is one that is masking a heart attack. Sometimes just nausea is something that is a symptom that we don't relate to a myocardial infarction, but certainly can present as such. And those would be two that I bring to the listener's attention.
Okay. And are there instances where a patient perhaps shouldn't go to the emergency room or should seek their medical questions or their medical care elsewhere?
Probably the most important in that regard are chronic problems, things that you've had for weeks, months, or years. Probably don't deserve to be evaluated in the emergency department. Chronic conditions like that, unless there's an extreme exacerbation of a chronic condition that warrants immediate medical attention, I would say those conditions are best seen in the primary care physician's office.
Okay, very good. And I think you have some exciting news that you want to share with us in relating to some of the advanced services that you have and some of the renovations that have gone on in the emergency room and how those renovations were brought about in terms of advances in care with the Guild Center and so on.
Sure. Well, 2 years ago, we opened our new emergency center, the Guild Emergency Center, that, as I mentioned earlier, was brought about by the fundraising efforts of the Guild, but more significantly by the generous support of the John and Marlene Bowl family. It was about a $15 million renovation. The emergency center at St. John Hospital is state-of-the-art and truly a tremendous resource to the citizens of the greater Grosse Pointe area that access care through that emergency department. We see over 115,000 patients a year through that emergency center.
That's amazing.
It is amazing, and we're one of the busiest emergency departments in the state of Michigan.